Hi, everyone, and welcome to episode 104 of the Veterinary Behaviour Chat. So I'm literally just back from the WSAVA Congress in Rio, which was amazing, a little bit tiring, but pretty amazing. And the streams I actually followed a lot were the pain streams this year. There were some amazing speakers on the pain side. And one of the topics that kept coming up again and again was this sort of interwovenness of pain and emotional states, in particular fear and anxiety. So I thought I'd do a bit of an episode on sort of my top three, I guess, takeaways as to why we think pain and these affective emotional states are so interlinked and intertwined. And I actually had a conversation with Paolo Stigal, an anaesthetist and pain specialist, about whether we can actually sort of try and prize apart, perhaps in hospital, when a patient is in hospital, what is pain, what is affective state, whether that's even possible, whether we should even do that, whether we should be considering treating both pain and emotional distress. And I think that's still a really sort of big topic. And I don't think anyone has the answers at the moment. And I think absolutely, when we're assessing for pain, we should also be assessing for emotional state, especially in our hospitalized patients, or not especially, but also in our hospitalized patients and, all of our patients, I think, essentially. But how to sort of extrapolate, is it pain, is it behavior, or is it emotional state? I think we're still sort of quite early on in those conversations and perhaps trying to understand what is what, and maybe we can't extrapolate between the two. Maybe we know that pain definitely has an emotional component, so maybe it's actually not possible to prize those apart. So perhaps when we're thinking about treating pain, we should also be thinking about treating emotional state. Anyway, those were some of the musings I came away with. But I did want to sort of give you my top three takeaways as to why I think pain and behavior are so inextricably linked and so very much intertwined. And these are certainly three things that I always think about when I'm thinking about my patients, and when I think about whether they might be painful or to what degree pain might be involved. Because I think it's also really dangerous to just tarnish everything as pain and not think about the emotional component, and only treat pain without treating the emotional component. So I think that's also not something that we should be doing. I think we should always be looking at the whole picture. But why is it that pain and behavior have become so very interwoven? And here are sort of my three things that I think about. So number one is that the body language, facial expression, and essentially behavioral signs of pain, but also fear and anxiety, can be so similar. And when you actually look at some of the sort of the pain scales and the behaviors that are mentioned on the pain scales, whether that's acute or chronic pain scales, and then you have a look at some of our sort of emotional scales, for example, our fear-free ladder of fear, anxiety, and stress, you'll see that there are so many behaviors on there that are identical, whether that is sort of facial expression, those kind of grimace things, which is oftentimes to do with muscular tension, maybe squinting eyes, maybe very sort of tense facial muscles that cause maybe frowning or orbital tightening, or kind of muzzle tensing and whisker splaying, those sorts of things. So that's one thing, but also things like restlessness, panting, pacing, being unable to settle. We see that so much with chronic pain, especially at night, but we also see that in chronic anxiety states or fear states, panting, patrolling, pacing, being hypervigilant, not being able to settle, sleep patterns being disrupted. That can absolutely be due to pain, but could also be due to emotional arousal or anxiety states and fear states. Being perhaps less motivated to have social interactions. Is that due to social anxiety, or is that due to withdrawal from pain? So you see where I'm going with this. There are so many behaviors that can be linked both to emotional state, but also to pain, whether that's acute or chronic pain, is that we really need to start kind of seeing that as a sort of a big picture piece, I think. And like I said, are we able to always decipher, is it pain or is it emotional state? No, probably not. And that's because I think pain does cause anxiety, and anxiety can cause pain, whether that's emotional pain or whether that's pain due to muscles being so tense for a prolonged period of time because of anxiety. I think that's really important. So I think when we're observing our patients, we have to be so open to thinking it could be a whole array of things. They could absolutely be intertwined, interlinked, and interwoven. But also, what do we need to consider then when we're treating that? So if we are thinking that pain is a component, do we then also need to be thinking about the anxiety that pain causes? And do we need to be thinking about treating both of those at the same time rather than one or the other? Of course, that can sometimes lead to diagnostic problems. Is it pain? Is it anxiety? If we're treating both, how will we ever know? But does it matter? So these are some of the questions I think that came up a lot for me in Rio, and that I did have some really interesting conversations about. And I think, as a profession, we're probably just not quite there yet. And we don't know, and we're probably not treating comprehensively enough. And I think, we sometimes forget that affective component of pain, because if we reduce pain, do we then also take away anxiety, or does that anxiety remain because the animal is perhaps anticipating that they might become painful again, or that something might happen that might cause them pain again? So is that then that anticipatory anxiety, does that remain? And do we need to treat that as well? So I don't think we have the answers, but just some big questions that came up for me. So I think that's the first thing, is understanding that when we're observing our patients, that when we're looking at them perhaps during a behavior consultation, really trying to understand that it's probably quite complex, and that we're seeing perhaps a number of different behaviors that could be associated with a number of different motivations: emotional motivations, physical health motivations, internal state, all that sort of thing. So that's my first point. My second point is actually a statement that was in the 2015 AAHA-AAFP pain guidelines. Now, this is not the most recent guideline. The most recent guideline is from 2022, but I really liked this statement from the 2015 pain guidelines, which is that it is now accepted that the most accurate method for evaluating pain in animals is not by physiological parameters, but by observation of behavior. So feeds on from my first point a little bit, but really interesting that we have that in these guidelines, and that absolutely sometimes the only or the first sign of pain is a change in behavior. So not necessarily something that we physiologically maybe see, not a data piece as such that we can collect, not a TPR, not perhaps even, a pressure plate or any of those sort of other, I guess, physiological measuring tools that we might have, but actually changes in behavior. And I think this is something that is really not widely appreciated by the veterinary profession yet, is that just because the patient isn't showing signs of agony, and this is something that I heard Kathy Murphy and Bobby Banbury talk about at the Animal Behaviour Kent conference this summer, is just because it's not agony, which is something that we are quite good at recognizing as a profession, as vets, doesn't mean that there's not pain present. So the animal doesn't have to be vocalizing or obviously limping for us to consider pain. But sometimes it's changes in behavior. It is that sleeping more. It is that withdrawal. Or maybe it's the opposite. Maybe it's seeking more social connection because, that animal is in need of comfort because it's painful. Those changes in behaviors that the animals have done all of their lives, hopping up into the car before they go for a walk, and all of a sudden they're not doing that anymore. So those subtle changes in behavior can absolutely be indications that we have pain, or that pain is now getting to a point where we really need to be taking it seriously. So I think that's the second big piece, is we need to be better at recognizing subtle behavior changes as indicators for pain, especially in older animals. And that sort of very common phrase that we say in veterinary behavior medicine is that, especially in an older animal, when we have sudden onset of behavior changes or sudden worsening of a previously stable behavioral state, then physical health is our absolute number one port of call. So again, I don't want to sort of, I guess, say that we should only be looking for physical health. We always need to consider the emotional piece too. And the two might be occurring symmetrically, together, bilaterally, at the same time. We need to always make sure that we are looking whether concurrently we have both physical and emotional health challenges and compromises. So it's not one or the other, it's potentially both, but being open to seeing that and how that is interlinked, but getting better at also appreciating caregivers when they say, I don't know, there's just something that's not quite right. Or sometimes our amazing paraprofessionals that spend a lot of time with our patients, that have maybe seen that patient over its lifetime, maybe trainers that have initially seen the dog for puppy consults and then are seeing them again slightly later in life, and can appreciate changes over a lifetime or over time. Or when they feel that their normally very successful training strategies aren't working in a particular patient, that's something that we should absolutely take seriously, that there might be a physical health component, but that there might also be an intertwining of physical and emotional health pieces. And we absolutely need to be involved in that. So that's my second piece, is we have to recognize subtle behavior changes as potentially initial indicators of pain or discomfort. It doesn't always have to be pain, it can be discomfort from other organ systems, whether that's skin or GI tract or any other kind of organ systems. Actually, I'm going to give you a bit of a story here, because this is something that's actually happened to me personally over the last few weeks. So I have an older dog, Lexi, she's probably about 12 or 13 now. We adopted her, so we're not entirely sure of her age. But she all of a sudden started showing some real changes in behavior over the last 3 months, I would say. And they were really kind of bizarre behavior changes. So she would be absolutely adamant that we had to leave the back door open for her to go in and out as she wanted to. And this was especially happening at night. So at night, traditionally, we always closed the back door. Everybody would be in during the night. And Lexi started massively barking at night, and she wouldn't stop. She was really adamant. She wouldn't stop until we opened the back door, and she was able to kind of go in and out as she wanted. That was probably the only real big change. There wasn't much change in anything else in terms of her mobility, her appetite, her sort of daily routines, I guess. But it was this constant kind of going in and out into the garden and coming back in, and this real sort of persistence of, she wanted the door to stay open so that she could access the indoors and the outdoors as she wanted. And this was going on for a little while. Initially, I thought, is she perhaps showing some cognitive dysfunction? Did a Disher score with her. There wasn't anything like massively on there other than those sort of changes in behavior. So I thought, let me take her to the clinic and let me have a look. So we know that she has for a couple of years now had some mild signs of kidney dysfunction, and we've been monitoring that regularly. That hasn't massively worsened or didn't acutely worsen. But I said, come on, let's do an ultrasound. Let's just have a look at her kidneys and let's have a look. And we did an ultrasound, and we found that her spleen was massively changed. So there were changes throughout her spleen, which at first we thought was likely neoplasia. But then we spoke to internal medicine specialists in the UK who said, no, it could also be a sign for an active infection. And given the region that we live in, we should test for blood parasites and perhaps tick-borne diseases and so on. And lo and behold, Lexi tested strongly positive for Ehrlichia, which is a tick-borne disease. And we also checked to see whether that was just an antibody reaction or whether that was an active infection, and it came back as an active infection. So we started treating her with doxycycline, and probably about 2 weeks into her doxycycline treatment, the behavior stopped. So she stopped the barking at night. She stopped her kind of very sort of adamant wanting to go in and out. And I mean, it's so bizarre. And her behavior in general is a lot better now. She's much brighter. She's much more socially interactive. And it was just sort of I guess, a change in behavior that had happened so slowly that we maybe didn't even see it so obviously. But it was that barking at night at the door that was kind of the trigger for me to dive a bit deeper into it. And we did talk to a number of sort of specialists about what that must feel like, having these sort of changes, these kind of really homogeneous changes throughout the spleen as a result of this sort of active infection. And, you know, everybody said that probably would have been quite uncomfortable in terms of, you know, her organ, her spleen, perhaps the way that it was sort of enlarging the organ somewhat and maybe causing her discomfort. So that just like a really sort of very tangible example of what I myself experienced with my own dog over the last couple of months, of how behavioral changes can be the first signs of physical disease. And I probably wouldn't have gone down the route of bloods and ultrasound and checking and seeing if I hadn't had that behavior change. So yeah, just a sign for us to be really aware of that. And then finally, my third big point is neuroanatomy and neurobiology, which I find absolutely fascinating, and how both fear as well as pain share some of the same neuroanatomy and some of the same pathways. And one of the biggest examples here is actually the amygdala and the changes that, the pathways, both the sort of the acute pain and fear pathways that are very much modulated, I guess, by the amygdala. And there are lots and lots of other examples there, but that we absolutely have neurobiological and neurobiochemical pathways that are shared by both pain and fear and anxiety, so affective emotional states. And we know, for example, a few sort of other things, such as the descending pain pathway that is very much modulated by serotonin and noradrenaline. Obviously, they're neurotransmitters that are also massively involved with affective emotional states and changes in behavioral signs. So just those commonalities, or those communal neurobiological processes, both through the amygdala, but also through some of the other pathways, whether they're pain pathways or fear and anxiety pathways, that they share these sort of common paths and common neurotransmitters. So glutamate is a massive neurotransmitter for pain, but is also a massive neurotransmitter for emotional arousal, impulsivity, high arousal, as I mentioned, inability to settle, all those things. So we've also got commonalities when it comes to neurotransmitters and those pathways. So those are some of the things I think about. So I think about expressions of, I think about how behavior changes can be the first signs of pain and discomfort. And I think about all those shared sort of neurobiological and neurobiochemical and neuroanatomical pathways and structures in the brain and the rest of the nervous system, and how, when we think about how they are shared, those pathways, it makes total sense that we are going to have behavior signs and pain signs that can be really similar, and that we can't probably extrapolate or separate out those affective states and pain, and that they're actually inextricably linked. So those are some of my musings about pain and behavior. I'm actually flying on to Saudi in an hour. I thought I would record this now. I'm flying on to Saudi in an hour to deliver a veterinary workshop together with Hannah Capon from Canine Arthritis Management. And we're going to be talking about exactly this topic, how behavior and pain are so linked. And it's going to be really interesting to see how the Saudi veterinary audience receives that, because in this region, and I think in so many other places in the world, and I think probably globally, there's still I don't think that we appreciate yet as an industry how this all is so sort of linked together, and how really we need to be thinking a lot more comprehensively and complexly when it comes to some of these things. So yeah, back from Rio, on to Saudi, and the topic stays the same: behavior and pain, which is what motivated me to record this episode today. So I really hope you enjoyed this episode. Now, I am going to put in the show notes the link to Psychoactive. If you're interested in some of the medications that can control both behavior and pain, and there are a whole bunch, I'm just going to say gabapentinoids, venlafaxine, some of the tricyclic antidepressants, some of the NMDA receptor antagonists have effects on both behavior and pain. If you'd like to learn more about that, there's loads in my Psychoactive course about that. And yes, so I'll put the link to that in the show notes. Of course, I'll put the link to my very popular client handouts ebook. And I have a new ebook coming out really, really soon, which is going to be a professional ebook that's going to have loads more resources for you as professionals in there. So watch this space for that. Until now, thank you so much for listening, and I'll see you next week for episode 105. Bye for now.